I am Dr. Vo, and with me is Dr. Adam. Okay. Dr. Adam is a fellow of the Royal College of Physicians and Surgeons in Canada. He is also a diplomat of American Academy of Pain Management. He was the former chief of University of Texas MD Anderson Cancer Center in the Neuropsychiatry and Neuro-Oncology Department. Welcome, Dr. Adam. It's an honor to be with you today.
My honor. Thank you.
Okay. Dr. Adam and I have worked extensively over the last 20 years in the field of traumatic brain injury and other neurological dysfunction. So today we want to talk about a very specific population that are afflicted by these conditions. As you all know, Houston is housed to the second largest Vietnamese population in the world. We have arrived here over the past 45 years from Vietnam due to the war and during 1975. Okay, so much to the myth of the model minority when we have people from all levels of the government, from government officials to doctors, lawyers, engineering, to business owner, nail salons. So we seem to be very well adjusted in this community. But behind the closed door, when Dr. Adam and I are dealing with a lot of treatment issue in the Vietnamese populations, some of the things that we uncover is it's a very heavily stress disorder population with post-traumatic stress with traumatic brain injury. So today, we would like to get Dr. Adam knowledge on traumatic brain injuries. So Dr. Adam, what are some reasons that people can have traumatic brain injuries in life?
Oh, there are many, many reasons. Being hit on the head, and with our population, trauma itself, produce tremendous amounts of damage. Bombs dropped near people with the loud explosions produced concussive injuries, especially with children.
Yes.
And I recall one of our patients she was telling us she remembers being 6 years old, sitting at her desk in school, just working away quietly. There was a flash of light, and the next thing she knew, she was all by herself, but still at her desk, but sitting in a field some distance away. And of course, has sustained the classic injuries that nobody noticed that she had. And she has suffered with it since she was a 6-year-old girl. Now she's I believe, a woman of about 40 years old. So she's really carried this with her for a long time. Domestic violence is a major, major problem in almost every culture. And it is generally overlooked by doctors. I'll see people who've been abused, women who've been abused, but they won't ask them, have you ever been struck in the head? Have you ever been knocked out? Ask them about their memory, and so on. So there, as I said, there are many, many reasons. Now we also have an additional problem in this country with the people who come out. Many of these women, of course, go into the beauty industry, as you know, and work in these nail salons. I don't know how many people have been in nail salons. I have been in several of them, and it's the fumes in there are just so highly toxic and concentrated. It cannot do these people any good working there with or without a previous brain injury.
Yes. So, Dr. Adam, you cover a wide range of problems that the Vietnamese immigrants have. So, being through a war of a 50 years wars, you cannot come out the same person. And a lot of our people, they sustain injuries as children. You're talking about bomb dropping in the backyard. You're talking about going through the killing fields, fleeing from one countryside to another. So once they arrived here, they also have to work really, really hard to make a living. The Vietnamese people are well known for our art and craft. So a lot of our women went into the beauty industry and then sustained what is called neurotoxicity due to the chemicals that they are exposed to on a daily basis. So you're talking about formaldehyde, toluene, methyl acrylic acid, you're talking about ammonium sulfate. These are the things that they use in pesticide, insecticide, air bombing fluid, that kind of things. So, I actually had a friend, she was working in a nail salon and she had 3 miscarriages. Until somebody told her that you need to stop in order to conceive a healthy child. So she stopped working and she did successfully have a healthy child. So a lot of these neurological deficits came out from the industry that people are not aware of. And it's underlooked by the medical professionals.
Yes, and what's really surprising is the medical profession really has not kept up with the traumatic brain injury field. Yeah. It's really quite sad, but the brain has actually been the last organ system not to be discovered, but to be paid serious attention to. We saw that with the football players.
Correct. Yes.
And it's any different with civilians as well. Not to mention the fact, of course, we think psychological as well. That's, whatever psychological is. The psychological trauma can actually damage the brain. We've seen that. We've got evidence of it. We see it on brain scans. And these people have been through the kinds of experiences that just leave you very sad to hear about. Yes. But just overwhelmed by what the human being can actually go through, sustain, and still somewhat stay alive.
So with pertaining to the Vietnamese population, what is shocking is the aftermath of the war, wartime trauma, issue like genocide, the killing field, and then seeing their relatives getting killed or being shot, in front of them, their eyes, with the communist brutality. So we are on this receiving end. We are the witness in history. And when we presented our situation, it's very difficult for people to understand, okay, your trauma was 40 years ago when you were 5 years old. So how come you still have post-traumatic stress? How come you still have memory disorder? Don't the brain has some neuroplasticity for you to recover? So what would your answer be for that, Dr. Adam?
Well, neuroplasticity is discussed considerably. There may be some mild evidence that such a phenomenon exists, but by and large, the neuroplasticity, if it's there, has great limitations. And once these brain injuries have been established, they will never change. The brain injury then has what we call an outcome of dementia. Everybody knows the name dementia, but assume that it's only elderly people. It doesn't matter what age or how you acquire dementia. The thing to be remembered by all doctors is that dementia is, first of all, untreatable. We have no medications for it, other than medications maybe to help you relax a little bit. It is not just untreatable, it's irreversible. Worse than that, it is progressive, and ultimately, over the years, it might be a couple of years, it might be for 30 years, it is ultimately a fatal condition to have. It kills.
So what you are saying is that once you have a brain injury, it doesn't go away. You can recover somewhat from it due to neuroplasticity. However, recovery is always incomplete.
Yes.
The brain injured cannot be comparable to a premorbid brain.
Right.
And the person just gradually deteriorated over time, and their condition became exacerbated due to aging and due to stress. Okay, and acculturation stress is something that is clinically validated, that when you unplug a tree from one garden and you plant it at a different region, the tree goes into shock. And it starts go into an apoptosis until it's reawakening itself. Okay, so when you work with the Vietnamese people and you uncover that they have a lot of motorcycle accident, drowning accident, because we are a country that's surrounded by water. Things like the joke that we usually have is that, he act like he fall into a well. We usually joke about that, but it's really real. If you fall into a well and you get fished out of there and you were unconscious for 30 minutes, that is a brain injury.
And a serious
serious one. Yes. Okay.
The thing that is very sad, and we can talk about individual conditions, headaches, the double vision. Everybody understands that.
Right.
Oh, yes. I know that. Yeah, memory, I sometimes forget too. I sometimes don't get the right word. Yeah, I know what you mean. That's quite different than the actual experience itself, because these people become something quite different than what they were. In other words, they're a different, very different human being. And it's extremely upsetting. It's untreatable. You can try to ameliorate some of the more pressing symptoms for comfort purposes, but you've been basically given a transplant, and the transplant has not been a good one.
Wow.
You got a very deficient organ now.
Wow.
And it does what it wants. So it's out of your control.
See you next time, and please take care of yourself and your loved ones.
If you would like to learn more about how traumatic brain injury can affect you and your loved ones, please subscribe to this channel and ring the bell at the bottom corner to be notified when a new video is uploaded. You can also reach out to Dr. Vo directly through her website. The link is in the description below.